So you joined your dad straight out of residency. So you were what, 30, 29 at
Yeah,
the
so
time?
about 30 years old.
And
Yeah.
your dad was in his 50s?
Yeah, so he was, it's interesting. He was 59 when I joined him, and then he was retired within the year or so. So he retired right around 60, which I feel like is crazy because that's only a decade away from where I sit now. And I think to myself, gosh, I feel like my career is going to be longer than that, but you never know. So, yeah, so I think in retrospect, he probably would have enjoyed working for maybe another 10 years. But I think he had worked like in his last 5 years, he was probably burning out. He was wild. He had literally LASIK clinics from Chicago, Kentucky, Michigan, Ohio, Indiana, North Carolina, Virginia, West Virginia, basically over 10 states in the Midwest, East Coast. He had LASIK centers, and he would have a van that would take the lasers from one location to the other. He was doing, a lot of those centers, 100 LASIK a day, and showing up, and just banging them out. Then the laser might have a problem, and they'd work till 2, 3, 4 a.m., finishing the LASIK cases, then getting packed up to go to another LASIK center. So he was on the road literally 4 or 5 days a week. And that's when LASIK was exploding. He kind of had put cataracts to the side, and LASIK was going to be his main income. And actually here in Cleveland, he was doing just, I think, 3 half days a month of work to support a whole practice. If you can imagine like what we're doing now. So he would come into Cleveland just 3 days a month, mostly do cataracts, and then worked with some optometrists that would kind of get the patients keyed up for him. And then those other, 17 days of the month, he was off doing LASIK. And so when I came in, the eye clinic was relatively small compared to what it is now, but it had a great foundation, great reputation, great referral pattern. And so we just started with one clinic when I bought it from my father, and then we ended up expanding, merging the LASIK clinic to the eye clinic, and then building an ASC, and then multiple other locations. So that was, kind of long story short, so sort of the path of that transition.